Greetings, YouTube. This one hit me a lot of left field because I had never considered this a possibility and was kind of floored when I discovered it was. Tens of thousands, perhaps hundreds of thousands of women around the world have had pelvic exams while under anesthesia without their consent or being informed, sometimes with multiple medical students doing an exam, each on a single patient. In 2014, the American College of Physicians released a paper suggesting that pelvic exams were not an effective diagnostic tool, and yet hospitals continue to let medical students get inside any woman under anesthesia, excuse me, including procedures unrelated to reproductive health. A study at University of Oklahoma found that a large majority of medical students had given pelvic exams to gynecological surgical patients who were under anesthesia, and that in nearly 3/4 of these cases the women had not consented to the exam. Medscape referenced a study done in Canada found that 72% of medical students admitted to having done a pelvic exam on an anesthetized patient. A common argument for this non-consensual pelvis exam is that many patients would say no. Okay, let that one wash over you for a second. They were concerned if they said, hey, we'd like to do a pelvic exam for you for a dozen students while you're unconscious. Would you be okay with that? And they're afraid they're going to say, nah, I really don't want that. Now, maybe part of the gynecological training should be establishing a relationship with someone so that they would be comfortable having a pelvic exam done with consent, if in fact that it is an effective diagnostic tool, which is under question. Now, I wonder how many prostate exams were done to patients that were unconscious without their consent. I'm betting that number is really low. Because apparently, if a woman is unconscious, you can do anything you want to her genitals. Not say anything. Ever. And for some reason, that doesn't violate the Hippocratic Oath of do no harm. Because if someone were to do this to an unconscious person at a house party, that would be rape. And yet, put it into a surgical theater with all white walls and gleaming metal everywhere, and put masks and, scrubs on people, and suddenly it's not rape to examine someone's pelvis without their permission while they're unconscious. I was floored by this one, folks. I was just like, you've got to be kidding me. It never occurred to me that doctors could be immoral in this particular manner. But nope, they can. So, if I were any woman watching this, I would find out if your state allows this. Because some states don't, I guess. And if it does, and if you have ever been unconscious in a hospital, a teaching hospital, talk to your doctor. Find out if you were one of these hundreds of thousands of women. And if you were, find a new doctor.